Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we'll be comparing the meningococci, and the gonococci. So to begin with the meningococci, the carbohydrates fermented, the meningococci, it includes the glucose and the maltose. Now when you look at the gonococci, it's G, so it only includes the glucose. Now when you look at the location, what does it have? It has both intra and the extracellular. In meningococci, it is both intra and the extracellular, whereas in case of the gonococci, it is only the intracellular. So how is the spread in meningococci? Spread is respiratory and the oral secretions. So respiratory and oral secretions, whereas in gonococcus, it is a sexual as well as a perinatal transmission. Now, how are the plasmids? In case of the meningococci, the plasmids it becomes rare, and in terms of the gonococci, has plasmids that code for the drug resistance. Now, vaccine is the capsule-based polysaccharide. It's a capsule-based polysaccharide, and also the conjugate vaccines are available. And except for the type B, subcapsular antigen-based vaccine is available. So in case of gonococci, there is no vaccine due to the antigenic variation of the pilus protein. Now, what about the capsule? So when you look at the capsule meningococci, it is present. The capsule is present in meningococci, whereas it is absent in gonococci. And how is the shape? The shape, it is kidney shaped in case of the gonococci, whereas it is lens and half moon in case of the meningococci. To learn and grow daily like this, please do subscribe.